Good morning and hello everybody. My name is Dr. Babak Bahadouri. I'm a gastroenterologist and internist, and besides I'm running my own health YouTube channel, Dr. Bahadouri YouTube channel, and I'm reporting today from Vienna. I'm participating in the EASD, the annual meeting of European study for study of diabetes. I'm very privileged and honored to have a very distinguished interview partner, Dr. Moller, Daniel Moller, from
correct.
Denmark. Dr. Moller, it's a great honor for us that you accepted our invitation. Doctor started his medical career in, I guess, 2000. He graduated from the University of Copenhagen in Denmark in medical science, and also obtained a PhD in
molecular genetics.
In molecular genetics, yes. And afterwards, he started his residence in internal medicine with focus in cardiology. And after 10 years, he changed to basic science and drug development. And that makes him very important for us as an interview partner, because he knows the both sides of the coin.
Yes.
The clinical work, working as a clinician, and the drug developing and basic science. So, Dr. Moller, again, thank you.
Thank you.
And I will start my interview with a reflection of my own career as a physician. You know, I started 33 years ago, my residency in 1993, literally in the last century. And after starting my residency in internal medicine, they immediately assigned me to diabetes outpatient clinic, and it took me only one day to realize why, because nobody wanted it. Back then, being a diabetologist was a frustrating job. You can remember back then we had only metformin, sulfonylurea, and insulin. And when it didn't work, it was game over. So the young physicians cannot imagine it. Limb amputations, blindness were around. It was our daily work, And the most frustrating work was to treat the obese patient, obesity. Many drugs have been developed and were withdrawn again because of side effects or because of the lacking efficacy. It was very frustrating. And suddenly, a major change has come. It was like a miracle, the discovery of incretins. It was, in my eyes, the turning point. And today, I keep telling my young physicians when they start moaning how hard the work is, I tell them you have no imagination how hard it used to be. Now we have effective weapons in fight against obesity, in fight against diabetes. And you have witnessed the whole thing from both sides. As a clinician, and you change to drug development, to change anything. It's very interesting, it's very exciting. Can you tell our viewers something about all the major achievements of last year around the incretins, and tell us, with these new drugs, have we reached the ceiling? It's the end of the game, or can we optimistically look in the future?
Great question, and I think first of all, I'm happy you also are here, so we can actually have this dialogue. So this is very important, and I think the journey has been long, and we have to remember this is a almost 30-year journey we are on now. So in Novo Nordisk, it was not by coincidence we actually figured out that GLP-1 could impact weight loss. So already in the mid-1995, I mean, during your medical studies,
during my residence,
during residence, we actually discovered in Novo Nordisk that there was an effect of the GLP-1 in actually having appetite regulation. So we proactively went into treating people with obesity. It wasn't a coincidence that we actually went there. So we have never seen this as an opportunistic way of entering a new disease area. We actually believed that we could do something good for the patients with actually having this molecule available to also treat people with obesity. And I think the biggest change has been, we have always known that there is a benefit of losing weight. We have known that for many, many years in type 2 diabetes, it was one of the cornerstones. When you had your residency, you would say, please try to lose weight, go home, make some lifestyle changes.
That was it.
Come back in 6 months, let's see how it goes. Then all of a sudden, it changed around the millennium's shift that, oh, now you need to start metformin fast because we need to do something good. And now fast forward to today, where I think we are seeing a very different approach to diabetes treatment and management, where it's much more individualized. So we have much more opportunities. We have different drug classes. So we have a much better understanding of what it takes to actually achieve the right goal for the patient in diabetes. We're not there yet in obesity. I think we have only kind of scratched the surface in understanding what is obesity. What does it mean for the person living with obesity, having obesity? Which elements do we need to treat? So I think for some years we have had a focus on losing weight, but I think going forward it will be how do we make sure that people are actually gaining health. So it's not just about losing the weight. Of course, that's also what a lot of people want, but it's actually the health gain. I think we should be remembering that some people have a higher impact on their health being living with obesity compared to others. So these people need to figure out the right treatment for them. So I think in the future, we will have more personalized medicine in obesity as we've seen in diabetes for the last 10, 15 years. I think we'll see the same shift in obesity. So the future will bring even more products. It will maybe be looking at not only that we can treat once a week, but maybe more infrequent with the injections. We will see more oral offerings, I think, for the patients. So I think there will be a wide variety of opportunities, just as we've seen in diabetes. So I think the future looks bright for people living with obesity, and also as a healthcare professional treating these people, I think the future looks quite bright.
I'm so grateful for this information because it's a very, very, very important point you mentioned. The health.
Yes.
Not the treatment, but the healing. So you already mentioned it's very, very good. It's very exciting. We have finally personalized medicine in diabetes. We have a tailored treatment, but diabetes is only the tip of the iceberg.
Yes.
In most of cases, obesity is the cause.
Yes.
And what we are doing and what we urgently need is a personalized medicine for obesity, like we have it for diabetes right now. And it was a very good point because you mentioned the health. I see that the health experts start slowly not speaking of increasing the lifespan, but increasing the health span.
Yes.
Because we have people with a good lifespan being 80 and above, but very ill.
I agree.
That's not the point.
Yes.
And if we can fight obesity with a more personalized medicine, which is exciting news for a viewer, we can increase the health span.
Yes. But I think health span is actually a good word and something I think more and more people are fascinating about and looking into. I know there's a lot of investigations looking into longevity, as you mentioned, that we live better lives longer. Not just live longer, but better lives longer. And I think here the treatments will play a role. I think we have seen that obesity is more and more acknowledged as a serious chronic disease. Is something we need to treat. Yeah, but I mean, for many years it has been stigmatized as just move more, eat less, go home, pull yourself together.
Not even recognized as a disease.
Exactly. So I think we have come a long way to actually make sure that we shouldn't do this blame game. We have to take serious that this is a disease where the brain plays a huge role. I mean, every single hormone will try to fight you if you try to lose weight. If you just fast, yes, you can lose weight, but everything in your body will try to counter it. Your metabolism will go down. Your brain will tell you, don't move, sit still, don't use energy. So I think there's a lot of complex homeostatic processes beginning and actually making sure you don't lose weight. So even though you really try, everything in your body and your brain will say, don't lose weight. Even though you might have very much excess body weight and fat, your body will really not be your friend, unfortunately, before we had the medications. So I think that it's changing the game. So hopefully it's very important to acknowledge taking medications or surgery or any intervention is not cheating. You are not cheating. So I think we really have to move away from people thinking, oh, you're taking the easy way out. There's no easy way out.
There is no easy way out.
Yeah.
Having working with obese people for 33 years, I can absolutely agree with you. It is complicated, yes. It's not easy. And as I told you, back then, yes. It was so frustrating because we kept telling, and nobody back then has realized that we are fighting a very complex disease. Back then, the major belief was that people should eat less. That's it.
Exactly.
And nobody has realized why doesn't it work.
Exactly.
Yeah, all these dietitians and
yes.
all the
yes.
measures back then.
Yeah.
Because it is a disease.
Yes.
It is not a weakness. It is a disease,
exactly.
and we have to treat it.
Yes.
We have to find out all the axes of pathogenesis,
yes.
and treat it
yes.
with drugs.
Yes.
And we can only this way we can fight this pandemic worldwide.
I agree, and I think we are also seeing the different academic societies beginning to understand this even better. I think we are seeing now proposals of how you actually look at this metabolic dysfunction, how you can maybe be able to stage it differently, so we understand as physicians, as clinicians, how do we look at our patients, which organs do we focus on, where do we look for end organ damages, how do we screen for the right diseases. So I think we are seeing a new avenue of possibilities to actually look at our patients and treat them holistically, not just for one disease, but maybe the underlying cause for what is impacting.
To put the focus on prevention.
Yes, exactly. So I think prevention will be a huge topic also going forward. So I think prevention and longevity, health span will be some of the buzzwords in the future.
Yeah.
And something we should have an eye on to see where are we moving. So this whole industry of health span is just exploding right these years. I mean, you have fitness experts, you have weight physicians and so on and so forth trying to engage in this dialogue as well. And I think this is where we need to be as well as a company to figure out how do we actually make sure that we develop the right things for the right purposes. And right now we are very much focusing on the health gain, not just that people should lose weight.
I'm very grateful you are doing that, because especially speaking of a company, I'm not here to make any promotions, but it's a historical fact that Novo Nordisk has always been a pioneer, back then to the discovery of insulin.
Thank you.
to save lives, but to be one of the first companies to produce insulin, and Novo has never stopped researching, because when you told me for example, just take an example, the research around incretins, GLP-1, started 1995.
Yes.
I was in my residency.
Yes.
Didn't have the slightest idea that something is going on which is going to be a game changer.
Yes.
And the young physicians just prescribe it, see the results, and can never imagine 30 years of research.
Yes.
Manpower, money, financial researches, many setbacks, of course, in order to give you a tool which works.
Yes.
And it's a great job you are doing, and it's a great job you as a clinician did to decide, I change the front, I go there. So I see now, I keep telling my young residents and physicians, I have witnessed many dreams have come true in the last 3 decades.
Yes, yes.
And when I'm talking about dreams coming true, you're working in the dream factory.
I am.
And I'm very grateful for you. And the best message was for our viewer, their future looks even brighter. Thanks to researchers like you.
Thank you.
Thank you very much.
Thank you very much. Thank you for coming.
Thank you for accepting our invitation.
Thank you.